Welcome back to the second half of the show. And now I am with Galina Boggis-Rolfe, who's a specialist in anxiety disorders. Good afternoon.
Hello, Ina. Thank you very much for inviting me.
Not a problem at all. So obviously we're coming out of lockdown now. A lot of people are very anxious. Your casebooks are probably going through the roof at the moment as well, with all the things you're having to deal with. What, first of all, are the simple things that people can do to actually feel probably safer as they come out?
Right. Yes, I've been really busy for the last few months with coronavirus and other problems related to it. And I've been really looking for answers, looking for the best solutions to prevention. Obviously, treatment. I'm doing treatment as well, but the treatment in the first symptoms. But prevention. This is very important. So what I'm telling people at the moment, first of all, don't be anxious, because anxiety, unfortunately, will lower your immune system. As this is very simple. So people get ill because they get worrying about getting ill. So I'm saying to them, don't worry, because if you will worry, it's more chance you would get ill. People think, well, how can we not worry? Well, of course, it's very difficult. So I have this list of very simple techniques what people can do not to worry. But first of all, it's very simple. It's breathing. Imagine when you start to worry, when you start to feeling stress, so it's a normal reaction of our body. Sympathetic system will turn on fight and flight response. So we start to have a shallow breathing. We don't breathe slowly and we don't breathe deeply. We're shallow breathing. Yes. So we're nervous. We're tensing. We're really tense, and we're shallow breathing. This is when your immune system will immediately, the reaction will drop. So you're really susceptible in this state to different problems. And if you're in this state for a long time, like some people been in this state of anxiety and stress for weeks or months, so you can expect the immune system is not working efficiently. So deep breathing, this is my first tip. Deep breathing and calming breathing. So imagine that when you breathe in, you turn on sympathetic nervous system responsible for stress. You breathe out, you turn on parasympathetic system responsible for regeneration and relaxation. So when you breathe, it's called abdominal breathing. You can even, would you like to try with me? You can even put one hand here. So right. When you breathe in, you told me it's good. Yes, you breathe here, breathing in, and your air goes here, and then breathing out. And you need to concentrate on the breathing out, because the longer the breath out, the more you activate your parasympathetic nervous system. Another thing here is really important, because when you do this abdominal breathing, you're opening your lungs. And what is the worst thing in coronavirus?
Of course, the lung infection.
Yeah, lung infection. So breathing is important. Not many people talk about breathing, but it's really important. So deep breathing, control, and that breathing will actually help to calm you down. If you're going into the panicky state, there's a really interesting technique. You can tap here slowly while you're doing this breathing, because you're calming yourself down. Okay, really slow. So what is the breathing about? As I said, it's important now to breathe. So it's important to get enough oxygen into our lungs. Talking about masks. So now a lot of discussions about masks, that mask prevents oxygen to get in. So I know it's not compulsory at the moment, but obviously it's suggested for people to wear masks. And people, I observe people, I can see they wear masks everywhere. You don't need to. Only if you're in contact with someone, if you go to the shop, when you're outside, you don't need to wear masks. Enjoy that fresh air, if it is obviously not Oxford Street in central London. So you do need to breathe oxygen, and obviously the masks, prevent. So wear masks when it's appropriate to wear it, but otherwise, deep breathing. Try to go in nature. very easy to go to the park, because again, if you're anxious about people you're getting coronavirus from, not the trees. So breathing, that's my first tip. Okay, so deep breathing and get enough oxygen into your lungs. Another tip, good sleep. Okay, so good sleep, it will regenerate the body. And to get the good sleep, if you feel anxious, because some people when they feel anxious, they can't sleep. So you do relaxation before you go to bed. Or you go for a walk, you have a bath, you do, relaxing, like Epsom salt bath is really, really good. Or you go, if we're talking about supplements, what actually the best supplement at the moment to get you into good sleep and give you actually good sleep, it's melatonin. Unfortunately, in this country, you can't get melatonin, but I'm sure other people, from different countries watching us at the moment. The melatonin, now been done study on the role of melatonin in prevention coronavirus. How? Because people getting better sleep, immune system is better. If you can't get melatonin, is because I do talks in Russian as well. Yes. Sometimes I confuse the terms. You can take L-tryptophan. The L-tryptophan is precursor to melatonin. And also it's a precursor to serotonin. And what is a serotonin? The happy hormones. So actually to take L-tryptophan during the day will make you happy.
So do you think at the moment, because it's very interesting, because obviously part of the problem was inflammation of the larynx and going into the lungs as well. And that's been one of the major causes perhaps of coming out of perhaps an induced coma or whatever it may be that coronavirus sufferers have had. So are there natural remedies that could sort of help with this situation as well, where either with the inflammation, because obviously this drug is being produced at the moment that is trying to reduce the inflammation, and it cuts down apparently the number of days that you're actually in a hospital bed. But are there other things like that that can actually, from your world, that can actually naturally perhaps calm down, not take away the virus, but calm down the effects in the lungs especially?
Well, I mean, when you're already in a hospital, it's very difficult to get anything else natural. Therefore, I always saying, if you don't want to get to the hospital, to that state of, very severe lung infection, so you do need to do prevention. I do have one thing which I use, a herbal remedy for prevention. I brought here. I know you like my remedies, so I brought one for you as well. This is called Strong Immune, okay? And it's a combination of the three main herbs for immune system and respiratory system. Echinacea, everybody knows about echinacea. Astragalus is a Chinese echinacea, and elderberry. Everybody forgetting about elderberry now because but remember, elderberry syrup for cough. So if you take these before as a prevention, so elderberry helps to clear mucous membranes. Additionally to deep breathing, what I said, and oxygen, because you do need to have oxygen because this is where this pockets of stagnation, as we're saying in natural medicine, starts to happen when you don't breathe properly. And you know that the risk people who in the risk group, elderly people, they don't breathe deeply. Okay, it's a shallow breathing. Okay, it's years of problems with maybe their lungs. So that's what I'm saying. If we're talking about natural, there are few other herbal tinctures that can help on the first stages of coronavirus, because I had many patients who would come to me with the first stage. So this is where I can help them. When they're already in a hospital, it's really difficult to help unless, what I said, deep breathing, even when you already in this state, because when you're breathing, the oxygen is coming to your lungs and its ventilation is obviously natural ventilation now. There's also interesting, if we're talking about natural medicine, there's a point here, if we're talking about reflexology, you can actually massage those points. Normally they are quite painful if there's a stagnation in this area. So if you're massaging those points, that can help. Even if you're lying in bed with coronavirus, you're breathing, deep breathing in that. There's a really simple advice, but actually I found it really, really works.
And obviously, you probably had all sorts of cases. What type of people are coming to you right now or during lockdown? Was it just purely anxiety, or were there other related things, or people just suffering from lockdown? Loneliness, for example?
Well, people coming with all sorts of things. Normally, I've been practicing for 20 years, and I treat all sorts of different problems. So not only with anxiety, not only with stress, but I'm looking at different problems from stress point of view. But yes, you're right. So people not only thinking about coronavirus, they're also thinking about some people lost jobs. They can't sleep. Or some people don't know what will happen in the future, or parents with children who are staying at home. That's I think one of the biggest problems that mothers getting into depression because the children constantly at home and they have to do the homework. That's another thing what I've been helping children with the concentration and with kind of treating hyperactivity, because they're at home, they don't have like an outlet. They can't, at some point they couldn't even go outside. So those things I was treating too. But mainly I was really concentrating on the immune system. I was doing lots of talks and interviews and live streams on Facebook, trying to educate people about, it's literally, immune system, it's your health, it's how you look after yourself.
And you're talking about children as well. I mean, can you help children as well? Is there, presumably, providing there's parental control and there are the right natural products, you can perhaps work with children, or can you? I don't know.
I can work with, yes, I work with babies. I work with pregnant women. So when the stress-related problems, I started to focus recently, because the level of stress is going up and up and up and up. Before during my career, I was doing different, like a specialization. Before I was expert in allergies. And then when I realized very often allergies are caused by a lot of stress. So I thought, why don't we address the cause of the problem? Stress, nervous system, and then the problem will go away. So I even started to do some body work with my patients, like some special exercises. There's amazing exercise. Maybe one day, if you invite me, I will tell you. It's the exercises. Those exercises came from a group of exercises came from Russia, and they use the exercises on people traumatized after natural disasters. Work fantastic, because it works with the right brain and nervous system calming down.
Now, a lot of people are worried about a second spike. What type of things should people be doing as well now? From a natural remedy situation as I say, because people, it's still not, really being defined how we catch this in the first place. They talk about droplets, but in reality, when the first four things like wash your hands and so forth came out, at the same time, I think from the World Health Organization, there was something like about 14 different symptoms that were never reported by the government. So what type of things should we be doing right now as well? Obviously eating healthily is one of the things. So what type of things would you advise?
Well, yes, eating healthy, it's very important, but some people don't really know how to eat healthy. And I always saying, do you try to eat organic and natural? Do you look at in your food? Unfortunately, because of the intensive farming, we try to produce all this food, lots of chemicals in our food. I got the little device testing chemicals, having fun with that. Drink a lot of water, but not tap water. So if we're talking about second wave, you need to prepare yourself to it. Okay, you need to really make sure that you go into the, people talking about October, you need to go into October fully in your full, immune system is strong. Look at it. There's so much information now. I mean, I can on my website there's some information there about how things work, why people getting ill, because it's very, very simple. If you keeping your body clean, if you don't taking, well, you see, if you're taking drugs, that's a risk factor, of course. If you're taking some drugs for high blood pressure drugs, that's unfortunately a risk factor. So if you know that, so you need to be extra healthy, I would say. Green smoothie, fantastic. Also, I'll give you very, very good advice about washing hands. Sanitizers, yes. So people saying that we need to wash hands, yes, that's fine. But the problem is, dry hands. And lots of people been complaining to me, what do I do? My hands are dry. Very, very good recipe, which I heard in one of the top experts in coronavirus. You make a mixture of iodine drops, and one part of iodine drops and 10 parts of coconut oil. Mix together, and you can put it on your hands, and it's really, really good antiseptic. And it's actually very good for your skin. So I recently tried antiseptic somewhere, and it was really, really. Another thing is very, very important. I brought it here. It's a propolis. I don't know if you ever heard about propolis. It's a bee made from bee. It's bee product, BZB. Right. Highly antiseptic. Again, studies been done recently on the coronavirus that propolis has high quality of protecting and boosting immune system. And this particular one, why I'm using this particular one, because this is in drops.
Okay.
And when we're saying that we're getting coronavirus where on our mucous membrane, so we're breathing it in basically, yes? So what you can do, you can actually put drops in your mouth after you came back, because the coronavirus, the virus will stay in your mouth for a few hours. Okay. Also, very, very important, wash your nose with the salt water when you come back. Maybe not now, but when you see more and more people, when a wave will start, for instance, if it will start, wash your nose with the salt water. So basically, you need to wash your mucous membrane. Lots of hot drinks, but I would say the hot drinks like herbal teas.
Yeah. So tell me, you've shown us two of these products, but what are the other two products that you brought with you today?
Right, but that's exactly what you were saying. This is called de-stress drops.
Okay.
So those drops, I think there's probably there's two, immune tonic and de-stress drops, two of the favorite products from my patients. And I designed those products specifically, so they designed in my clinic. It's not commercially. But people getting more for their friends and families. Those drops, they are Dr. Bach flower essences. Do you know Rescue Remedy? Have you ever heard about Rescue Remedy? Well, I know it because you don't normally stress. You're such a cool person, so you don't know those.
Sometimes I do.
So this is de-stress drops, and what it does, it's calming down nervous system. Flower essence this is invented in England by Dr. Bach. Okay. In a long time ago, and people really love them. But they specifically, if we compare them with Rescue Remedy, they specifically affect the nervous system, calm down the nervous system. When you just like, oh, I'm frightened or I'm stressed, they're just like, oh.
Very good.
And the second one, again, is very important. It's called Super Detox for your liver.
Okay.
Flushing the toxins.
Yeah.
Pure herbal tinctures, and they're really, really efficient. When flu season in the past, when flu season would start, I always say to people, take those two, immune system and liver detox, because those two go together. If your liver is toxic, if your body is toxic, you're more susceptible to cold and flu.
Yeah.
So those are kind of, I brought you some
excellent, thank you. Time is catching up with us, unfortunately, again today. So tell me, how can people get in touch with you?
Right, this is my website, absolutehealth.pro. They can write to me email. I am on social media, on Facebook, not much on Instagram yet, on Facebook, Galina Ganzenko, Boggis-Rolfe.
And you're doing these live streams as well?
I'm doing live streams, but I'm doing live streams at the moment mainly in Russian, because I have lots of Russian I'm known very much in Russian community around the world, sure. But I'm planning to do it in English as well. So yes, I'm quite a lot on social media.
Well, thank you so much for your time again today. It's been very informative, and I hope it's helped a lot of our viewers to actually just calm down. Thank you so much.
Breathe. Thank you very much, Ian.
Thank you. Well, that's another show from the Voice of London with me, Ian Pelham on ALB UK Television and positivebritain.co.uk. I hope you've had a great day. I hope you've enjoyed this show, and I will see you again next week. Take care. From Galina and myself,
bye-bye.
Bye for now.